Hi, I'm Dr. Leo Powers, and I'm going to talk about hand arthritis, Dupuytren's contraction today. And it's caused by lack of endurance to the hand, right in here, and it gets kind of a V-shaped, tight muscle thing in your hand, and it's because there's lack of endurance in the bones of the hand that are called metacarpals that are right in here. These bones through here. And the muscles for the bones in the hands are in the forearm, right in there. And then the forearm is affected a lot by the biceps muscle right here. So in order to fix it, you have to move your hand in a position where it's stretched back, and then these bones need to be adjusted. And when I adjust the bones, it's very gentle. It's a light thrust, and then I work on the forearm, either the front or the back of the forearm through here. And then the adjustment is kind of like you're in a position like you're a baseball pitcher. You're pulling back for that throw of the baseball like that. Well, you don't have to have your forearm up that way. You can breathe like this, but you have to stretch this whole area up in here. And then I do the adjustment on it, and then you got to keep your arm back like that while you're getting it adjusted. And then you work on the head part, which is the endurance part that ties in with the head adjustments. And I learned how to do the cranial work back in 2000. And the connection between endurance is right up through here. This bone here, this is color-coded. There's different bones in the head, but the top of the head is where the endurance drainage port is. And so that needs to be adjusted after you adjust the hand bones and the forearm. And the middle bone for the whole head is that sphenoid area right up in here, and that has to move. And it normally moves kind of like this in the middle, because the other bones have to move around it as you breathe in and breathe out. And so the adjustment is where I pull lightly up on the nose or down on the nose, and then you need to lift up on the palate through here, and when you lift up, then that lifts up on the middle nasium bone, middle bone of your nose, and that lifts the sphenoid area up here, and so that lifts up, and then that lifts the roof of the head, which is this part through here. And then once that's lifted, which takes 1 to 2 minutes, and it's a very gentle treatment. And so then you come through here, and I reset this midline with the temporal bone here, and there's 3 points that I touch on. And so the 3 points would be reset as you work on one side, and then you turn over and work on the other side with the other side up in there. And that's basically how simple it is. It's a simple adjustment, and it does take quite a while to learn how to do it. But there's indicators to tell you how and when to adjust that area. And basically, I had a patient that had it for, I believe it was 3 years, and they got the adjustment, and then they got better. So you can stand up and talk.
Hi. When I first started coming to Doc Powers, I was telling him about breaking my hand and how it was starting to contract on me. And so when I first came in, it was kind of at an angle and twisted, and I couldn't lay it flat. After he adjusted me, I can put my hands together, I can lay it flat, I can hold things, I have a lot better grip. And the greatest thing of all is no surgery involved.